Hey everyone, it's Dr. Gruber, and today I wanted to give you a little bit of info about dry eye disease and specifically meibomian gland dysfunction. So, meibomian glands are little tiny oil glands that live at the top and bottom of our eyelids. And every time we blink, they squeeze out fresh oil like olive oil onto the front surface of our eye, and it acts as a protective buffer layer for the tears we produce. Most people think that when you have dry eye, you need to add eye drops. But most of the time, we produce enough tears. The real issue is keeping those tears stable. And when we don't blink enough, which happens over time and due to a lot of other factors, the oil glands start to harden and congeal. And then we don't express that oil any longer. And so, if I can kind of show you here, these are what healthy oil glands look like. And as you look down, as the oil glands start to harden and congeal, they don't work anymore and we lose them. The average person blinks 20 times a minute in normal life. People who work on computers all day or do visually demanding tasks, things like driving, knitting, or really anything where you're staring intently, you blink about 5 times a minute, so 75% less. What I recommend for patients who are suffering from dry eye, this is my favorite product. It is a microwavable heat mask. Now, there are instructions for use and cleaning on them, but these last a year. They're really affordable and they make a huge difference. So you throw it in the microwave for about 20 seconds or about as hot as you can handle without burning yourself. The heat in one of these stays hot for almost 10 minutes versus a warm washcloth will only last about 20 seconds or so at its proper therapeutic temperature range. The heat is going to expand the oil glands because heat expands. It also is going to melt that hardened oil and remove it from the clogged oil glands and allow fresh oil to start coming out. This is the most impactful way to start reversing the damage done to the oil glands over time. Because believe it or not, we can actually turn these little atrophied glands back into here with some effort. So if you're having some dry eye issues and really struggling, this is homework, but for me, it feels like a spot treatment. I fall asleep with mine on. It's my favorite thing to recommend to a patient when they're starting out on their dry eye journey to reversing it. And if you have any other questions, I'm happy to see you and give you some more information. Cheers.